Hi, Jen. You go by Jen?
Yes.
Nice to meet you. Thank you so much for coming into the clinic today. I'm Danielle. I'm the student nurse practitioner. And so, what I want to do is get a little bit of a health history from you. And it sounds like we're just establishing care.
Okay. Yep. I moved and I need a new
Okay.
primary provider.
Okay.
Yep.
Just want to make sure that we're on the same page.
Yep.
So, just establishing care is kind of your reason for being here. Can you tell me if you have any current illnesses going on, or?
No, right now I'm fairly healthy. I just
Okay.
kind of want to make sure I have a provider in case something happens.
Okay, it's reasonable. Yeah.
Yeah.
How about, are you on any medications right now?
Multivitamin.
Okay. Good. You taking that daily or?
Every day. Yep.
Okay, very good. Do you have any allergies to drugs or food that you're aware of?
No drug allergies. I don't think it's a true allergy necessarily, but shrimp get a little GI distress. But that's
Okay.
it as far as food allergy,
Okay.
which probably isn't a true allergy, just a reaction. Yeah.
How about tobacco or alcohol? Any smoking, tobacco products?
No tobacco products. Occasional drinking, social.
Okay.
Maybe one or two on a weekend.
Let's talk a little bit about your past medical history. Anything significant or childhood illness, childhood?
No childhood illness. I had a gastric sleeve done in 2019, I believe it was. Had a little GERD after that, but it's all better now. And then I have polycystic ovaries. That's part of my health history. Other than that, really nothing.
Okay. For your polycystic ovaries, excuse me, are you doing anything, any type of treatments for that? Are you?
No, nothing now. Long ago, they had me on birth control for that, and then I took some hydrochlorothiazide, but that was long ago as well. It helped minimize some of the symptoms of, but it's been many years now since I've been on those things.
Okay. Are you having any symptoms or discomfort currently with that diagnosis? Anything that's happening, or has it been stable since?
It's been stable.
Okay.
Yep.
Can you tell me a little bit about anything that you're doing currently or have done in the past for sort of health maintenance practice, working out,
I
mental
do try
health
to
practice?
exercise. Yep.
Okay.
Hiking, walking, that kind of stuff. Go to the cabin. Try to rest, relax, hang out with
Nice.
friends, that kind of stuff.
Very good.
Mm-hmm.
You just told me about surgical wise, you've had the gastric sleeve. Any other surgical procedures that you can?
I had a DNC at one point, but other than that, no.
Okay. Family history.
Cancer. So mom's side, cancer, breast, uterine. Then it matched to lungs after that. Hypertension, and she had hypothyroid also. Grandma had stroke and some TIA symptoms. Let's see, dad, hypertension and some AFib on my dad's side.
Okay.
And then cancer on my grandpa's side, grandfather's side as well. Melanoma over there. Otherwise, I think that's about it.
Okay.
Yeah.
So social history wise, are you single, married?
Married?
Married, okay. How about sexual partners? Are you active and are you male,
Sexually
female?
active, monogamous,
Okay.
male partner.
Let's talk a little bit, switch gears, talk a little bit about diet.
Mm-hmm.
How do you feel about your diet?
Pretty good. So after the sleeve, I was pretty strict with my diet and portion sizes and whatnot, and now I still have to portion size. It's like, which I shouldn't do this, but it's like frequent small meals. I'm supposed to just have my 3 small meals and no snacking or whatever. But I did start to snack a bit, put on a little weight since that. time frame, which I would love to try to get back down a little bit, but weight loss has always been a struggle.
Sure.
Yeah.
Do you ever feel like you have any instances of food insecurity or trouble accessing groceries, preparing meals at home?
No. Other than when I work late and can't get to the grocery store. That's my struggle.
I think we all have
Time
a little
management.
bit of that, right? How about safety? Do you feel like you're safe in your home?
Yes,
Do you wear a bike helmet when you bike?
of course.
How about a seatbelt when you
Yes.
drive? Okay, very good. Mood. How do you feel your mood has been recently?
I think I'm okay. Work is stressful a little bit for the most part. I'm alright.
Do you feel like you have healthy coping mechanisms for work stress?
Try to exercise, vent to
Okay.
friends,
Okay.
shop, maybe a little shopping. Maybe that's a little problematic.
It's fair. And cognitive. Any issues cognitively that you can think of, or any struggle, fuzziness, forgetful?
No, I don't think so. Okay. Seems normal.
So, what I'd like to do now is kind of go through just a general review of all your body systems, just to make sure that I'm not missing anything in terms of things that might be of concern or we might need to address in your clinic visits. Do you have any questions for me so far?
I don't think so. Yeah.
So you kind of touched a little bit generally on a little bit of weight gain that you're feeling like you've experienced lately, but it sounds like what I hear you say is that you kind of feel like you need to kind of readjust your meal frequency, reduce snacking,
Yeah.
exercise, which all sounds great to me. Any other things like weakness, fatigue, fevers?
No.
Okay. How about anything on your skin? Any rashes, lumps, bumps, itching,
No.
strange
Seems
things with
okay.
your skin? Okay.
Mm-mm.
Change in hair, nails?
No.
Okay. How about moles? Any moles that you're aware of that have grown, changed?
Nothing that's changed. I've had some mole removal back in the day. Forgot to tell
Okay.
you about, I suppose, but those areas are fine.
Okay. Mole removal for aesthetic reasons, or was there concern?
New growth. That was like a rapid growing mole on my back.
Okay.
It's probably been 10 years or so, and
Okay.
it has not returned. And then there was one behind my knee as well, like skin tags. I had a couple random skin tags removed. But there was a mole that I had removed, and they sent it up for biopsy. It was fine.
Okay. Skin tags can just be irritation.
Mm-hmm.
Anything, headaches, dizziness, or vision?
No, I think I've had some eye strain lately, doing more of an office job now, but
Okay.
I gotta work through that, so.
Okay. Have you ever worn glasses?
Long ago, then I had LASIK surgery done, maybe in 2016.
And has that been successful for you, or have you noticed
It was,
reverting?
well, now that I've fast forward a few years, it's, maybe my astigmatism is back, or
Okay. When's the last eye exam that you had?
a few years ago.
Hearing, any earaches, infections, discharge?
No,
How about any oral cavity things, sores, bleeding gums,
no, that's all been okay.
dry mouth,
No,
anything like that? Okay. Any concerns in the neck? Any lumps, bumps, soreness? Okay. How about in the breast area? Any breast discomfort? Do you do self-exams?
I do self-exams. Maybe I should do it a little more regularly, but I try to every couple months.
Okay,
And then I do my annual mammograms.
got it.
With my mom's history of breast cancer, I started in my early 30s getting annual mammograms.
Respiratory coughs, chest congestion,
Nope.
irritation,
Seems good.
Okay.
Yeah.
heart trouble, blood pressure,
No, I've not noticed anything.
nothing. Okay.
Mhm.
Any swelling in the hands, ankles,
No.
feet? Okay. How about gastrointestinally? Are any trouble swallowing, heartburn?
Nope, not anymore. Just back when I first had my surgery a few
Okay.
years back, and that seems to be okay. They kind of told me that you might struggle with GERD or heartburn post surgery forever, but for the most part, it's pretty good.
Regular bowel movements?
Yep.
Any leg pain? Leg
No.
cramps, varicose veins,
Nope.
past swelling, clotting, anything in the lower extremities?
No issues.
How about with urination? Any frequency, urgency, burning?
Nope, normal.
Are you regular with your pelvic exams, or how
Yes.
frequently are you going?
The standard every 5 years. I've had no
Okay.
unusual results, so
Okay. And so it sounds like too with PCOS, are you having any? It sounds like you're pretty stable, but has there been any increase that you've noticed in discomfort, cramping?
no.
Okay.
So far, so good.
Okay. Any muscle weakness, stiffness, tenderness?
Yeah. No. If I work out too much, just the standard. Nothing unusual, unaccounted for
Okay.
situations.
How about any with your mood? Any nervousness, increased nervousness, anxiousness? I know you kind of mentioned work stress, but anything more pronounced for you?
Yeah, no, it's been okay.
We also talked about kind of orientation and mood stuff, so no confusion, memory loss, anything in that realm.
No, I think it's alright.
Any easy bruising or bleeding that you've ever noticed?
No.
Heat or cold intolerance?
I feel like I'm always cold, but
Oh.
that's
Is that
after
new?
surgery. No.
Okay.
New post surgery, and then with the rapid weight loss, and then I was just always
Sure.
cold. So
Okay. What questions do you have?
I don't think I have any questions.
Okay, good. I think overall everything sounds like we're in pretty good health. I would recommend scheduling your mammogram if you haven't done so already. I would continue with your schedule of your pap and pelvic exams. You've had an unremarkable history to this point where now it's okay for you to do the 5 years out. I think that's acceptable. I encourage you to continue your efforts on working out. I think that's helpful for everything: cardiovascular health, weight, mental health. I think that's a good stress reliever, especially with coping with work stress. So that would be my recommendation, is just kind of follow up with your regular exams and get those scheduled if you don't have them on the books. And if something changes or comes up, especially with your PCOS or anything to do with your having a gastric sleeve done, if there is any abdominal discomfort or anything like that comes up new, let's talk about it to make sure that we're not having complications. But I don't anticipate that given how far out you are. So, okay, well, I thank you for your time, and I appreciate you coming in, and I look forward to seeing you.
Thank you.